Hi, we're sitting here with Mark, and Mark, we did PRP with the low back, right? If you before you did this, when you were sitting with Trish, your wife, and we were talking, would you mind talking about a little bit of how skeptical you were or nervous you were about doing this procedure?
Yeah, I think my biggest concern, as we were just talking about, my biggest concern was that since this was a muscular thing and not a spinal thing, and you know my back is a bad Jenga game. My lower back looks like piles of wood. And my biggest concern was that the muscle would actually heal and or move in a way that might be good for your normal back, but not for mine. And so my biggest concern was that my spine would move a little bit,
and then essentially cause more issues.
and then cause stenosis in my
Because
back.
we're dealing with
Because
that in
I've
the
dealt
back.
with that a lot, off and on.
And you were talking about having some numbness down the legs.
I didn't have it after the procedure, but that was my biggest fear of the procedure.
Okay.
Was that it was going to heal
Yeah.
nicely,
But then you would be
but
worse.
that could throw my back off because mine doesn't look like any normal back.
No, it did not, did it?
So no. So yeah, so immediately after the procedure and before the procedure, I had some muscle spasms. That increased after the procedure, or continued after the procedure, and seemed to move from spot to spot.
Yeah, it started moving on us,
It walked from one side to the other and then started working its way up my back. And in the last couple of weeks, about the last week and a half, things are smoothing out. So I'm going to get my next jab.
And how happy are you that you did this?
So far, I'm real happy I did it.
Pleased with the results.
So yeah, I'm pleased
Things
with the
have
results.
not gotten worse; they've gotten better.
Like I said, that was my biggest concern of the whole thing.
Yep.
And that was alleviated.
Good.
So,
if you have any questions with the low back PRP procedure or Mark's procedure that we're doing with him, you can call the office at 636-239-5252. Thank you.